Allison. I'm a junior nursing major. I'll be checking off Stacy on head, neck, and lymph nodes. It is September 11th, and it is 2:40.
I, Jessica Krause, hereby give my written and verbal consent to be filmed in the Liberty University Nursing Exam Suites in the Nursing Department at Liberty University as part of the Nurse 210 Adult Health Assessment, Nurse 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission for the film containing my image to be submitted to a secure YouTube site viewable by the nursing student and instructor of the course. I understand that during the examination and filming, areas of my body will be uncovered, exposed, inspected, palpated, percussed, and auscultated by the student nurse. With this understanding, I give my consent.
Okay. Hi, I'm Stacy. I'm going to be assessing your head, neck, and lymph today. Can I have your name and date of birth?
Jessica Krause, 10/17/93.
Okay, first I'm going to start with your lymphatic system. Upon inspection, the patient has no visible lymph nodes. There's no redness, edema, or erythema. On palpation, I'm starting with the preauricular lymph nodes, postauricular, occipital, temporal, parotid, submandibular, sublingual, and submental. Now I'm doing the anterior cervical chain, posterior cervical chain, and deep cervical chain. And on palpation of the deep cervical chain, there is a palpable lymph node on the patient's left side in the posterior aspect. It is smooth and it is freely movable. There is no additional warmth on that side. There's no redness or erythema there. Can you raise your shoulders for me? Okay, now I'm palpating the supraclavicular lymph nodes and there's no nodules there. On a normal patient, there should be no palpable lymph nodes anywhere, and I could also palpate lymph nodes in the epitrochlear region, the inguinal region, and in the axillary region. Now I'm going to assess the patient's head. The patient's face is oval-shaped. It is upright in midline. It is atraumatic. It's normal cephalic. There are no unusual facial features, tics, or lesions. Now I'm going to test the patient's facial sensation, which is cranial nerve number 5, and the trigeminal nerve. So I'm going to have you tell me if I'm touching you with the soft side or with the sharp side and where on your face I'm doing that, okay? So can you close your eyes?
Mm-hmm. Soft forehead, soft cheek, hard chin, hard forehead, hard cheek, soft chin.
Okay, good. Now I'm going to test the masseter muscle. So I'm going to have you move just your jaw against my resistance. Okay, good. Now forward. And now this way. Okay, good. So there's no abnormalities with cranial nerve number 5. I'm going to move on to cranial nerve number 7, your facial nerve, which assesses facial. We're going to do facial gymnastics, okay? So first, can you say your name for me?
Jessie.
Okay, so the nasolabial fold shows no abnormalities. Can I have you close your eyes for me and raise your eyebrows? Now keep them closed against my resistance. Good. Can you smile with your teeth? Smile without your teeth? Can you puff your cheeks? Can you purse your lips? Can you frown? Okay, good. So there's no abnormalities of cranial nerve number 7. Now I'm going to palpate the patient's face in her frontal sinuses and in her mastoid sinuses. Is there any tenderness there?
No.
Okay, good. No abnormalities there. Now I'm going to move on to the patient's scalp. Her scalp is freely movable and there are no lumps, lesions, or scaliness there. Now I'm going to assess the patient's neck. The neck is bilaterally symmetrical in relation to the sternocleidomastoid muscle and the trapezius muscle. The patient's, can you look up for me and swallow? The patient's trachea rises and falls smoothly. There are no signs of jugular vein distension. Can you go ahead and look to your left and to your right? Okay, the anterior and posterior triangles of her sternocleidomastoid muscle are symmetrical and there's no abnormalities there. I'm going to assess for neck pain, so can you go ahead and look down against my resistance of flexion? Good, and up. Is there any pain there? Okay, good. Now I'm going to have you stand up. I'm going to palpate your trachea. Can you look up again and swallow? Okay, good. There's no tugging in the trachea. Can you turn around for me? I'm going to palpate the patient's thyroid. So can you tilt your head this way? Okay. Now tilt it the other way and down slightly. Okay, is there any tenderness there?
No.
Okay, the patient's thyroid shows no signs of any abnormal nodules or tenderness. There's no enlargement there. Now I'm going to auscultate the patient. You can sit back down. For bruits in her temporal artery first using the bell. Okay. Okay, no bruise in the temporal artery. Can I have you look up? Can you hold your breath for me? Okay, and there's no bruise in her thyroid region and no abnormalities in the carotid arteries. Now I'm going to check your jaw for crepitus, so can you just open and close your jaw for me? Okay, do it one more time. Okay, the patient does show some positive signs for crepitus, and that is your head, neck, and lymph assessment.